The road to recovery of an ACL tear is a long and difficult one. The ACL is a ligament that connects the bones in the knee. Tears of the anterior cruciate ligament, better known as the ACL, are incapacitating injuries that can occur during everyday activities. Whether it is a mild rupture or a severe tear, everyone is at risk, even you.
The ACL is one of the more common injuries that you hear about in athletics. It doesn't happen as much as some other injuries like ankle sprains or things like that, but the problem is when you do tear your ACL, you tend to miss a year of activity.
The ACL is this ligament here, and it runs from the tibia, the lower bone, up to the femur, where it connects on the outside portion of the condyle, or the lateral femoral condyle. And this is about the size of what the ACL would look like in a native knee.
When a patient comes into the office and you twisted your knee, whether it hurt or not, you say you heard a pop, and later that afternoon or that evening you had swelling in your knee, I would tell you about 80% of the time you have an ACL tear, and that's without me examining you or doing any more questions.
A particular type of movement that we would see in a non-contact injury, for example, in basketball, when the athlete jumps up for a rebound and comes down to the ground, they land awkwardly, or they land and they try to rotate and change directions suddenly, and that's where they will sustain a ligamentous tear of the ACL.
I tore the first one. It was actually a week after I was done playing soccer, and I was playing another intramural sport, football, flag football, and I was the running back, and I went to do a cut, and it twisted as well, and I fell.
The ACL is responsible for preventing the tibia from translating anteriorly on the femur, and one of the hallmark tests is going to be called Walkmans Test, and that's going to be where I'm going to pick up the femur and the tibia and translate them on one another, and I'm going to compare bilaterally. If there's an ACL tear, the tibia will come out a lot further on the femur, whereas compared to the other side, there won't be as much laxity. It's going to be some of the most painful rehab an athlete can go through. 6 to 8 months of intense rehab.
I mean, going into it, I was kind of afraid. I've heard it's like the most painful thing. Now the most painful part is over, so now it's kind of just exciting seeing how much progress I've made.
I was afraid to hurt myself again after the surgery. I didn't want to damage myself more. I really like volleyball and I want to keep playing it, so I was afraid to hurt myself again.
There's a variety of different exercises you can do in physical therapy to rebuild the muscles following an ACL injury.
Focus on increasing quad and hamstring strength, so anything from like squats, leg press, biking is a good one to start out with.
I started running probably like three months after the surgery. Actually, I came back better. I came back faster and bigger and stronger.
A study presented by the American Academy of Orthopedic Surgeons found that senior citizens who undergo ACL surgery are just as likely as younger people to return to pre-injury levels of activity.
You know, in 50 and 60-year-olds who, again, 10, 20 years ago you would say, you're 60-year-olds, you tore your ACL, just live with it.
The biggest risk factor for an orthopedic injury is recent history of having that injury before. So obviously the older you are, the more opportunity you're going to have a history of that problem. So yeah, you are at more risk when you're older, but not just because of your age, more because of the experience of your body over that time.
You know, now we have 6-year-olds who are still very, very active. I mean, our population is aging, and as a result of that, and as our aging population is healthier, and so wanting to stay more active, they're doing activities that they didn't used to do and putting themselves at risk, and so they can have an ACL tear.
Doctors in Philadelphia documented a 400% increase in ACL injuries among teens and adolescents over the last 10 years. A torn ACL can threaten to end a teenage athlete's career before it even begins.
Usually it's, you're getting into your teens, sometimes a little bit below teens, but that's pretty unusual. So teenage and above is typically where you see it.
As it is clear, ACL tears are not just reserved for male athletes. From an increase in young athletes tearing their ACLs to new findings that show women are more prone to ACL injuries in numerous ways, ACL tears occur when you least expect it.